Oh, yeah. Before you get started with the client, remember to adjust your table height.
Recording in progress.
Ask the client their preferred product preference.
Check.
Ask the client about injuries, painful, sore, tight areas. Request.
Check.
Preferred depth of pressure. Any areas that you do not want to touch.
Okay.
Once you re-enter the room, remember to offer the client a bolster under their ankles and adjust the height.
We did that.
To ask the client if they want the table warmer on, how high, and check in on the temperature and adjust.
You doing okay with the temperature?
Yes.
Okay.
To let the client know how the face cradle adjusts, to ask the client if they prefer it higher, lower, wider, or narrower. Optionals. Static hold between shoulder blades and low back or sacrum. Warm up hands first. Use confident, heavy-handed pressure. Take at least 3 deep breaths. You can also invite the client to take deep breaths. Begin to notice how the client breathes, how the client's breath moves through their body, and where they are restricted. To compress on back and or whole body. Undrape back.
Okay, so when I do my static hold, I'm already observing what's going on in the body. I'm getting a little preview of what's happening. Sometimes I'll just do a little like pat up and down just to kind of get the lay of the land. What I'm feeling with Keisha is that there's a lot of tension right at the sacroiliac junction right here and the top of the ilium. All right. Is it all right if I undrape your back down to your sacrum?
Yes.
Okay. Okay. Is it all right if I tuck the sheet into your pants or underwear?
Yes.
Okay. So when somebody is wearing anything on their lower half, I give myself like a little bit extra sheet here than I would if they were wearing nothing and that was going to be my border, because the top of their garment is going to be my border, but I need something to tuck in. So I just do a quick tuck. And then a tuck around the side. And I think, there we go. Sometimes if the bottom sheet gets pushed when you're trying to tuck, you're not going to get a very secure tuck under there. So you saw me pull the bottom sheet taut so that I could actually tuck it under her body instead of trying to tuck it into a pocket on the bottom sheet. Okay, what are we doing first?
Opening effleurage butterfly. Stand in a lunge position at the head of the table facing the client's feet. Place hands on upper back on either side of spine with fingers pointing towards the feet. Keep wrists in neutral position.
All right. So I make sure I have adequate lotion. Make sure it's spread all over my hands. And then when we start, we're going to land it like a plane. We're going to just gently, smoothly swoop in. All right, and I can already tell I need a little bit more lotion. So the butterfly stroke travels on either side of the spine down to the top of the iliac crest and then out. And if I have somebody who is particularly long torsoed, when I travel down, I will take a step to the side so that I'm not trying to bend over them and I avoid touching them with my body. I tend to break up the butterfly a little bit so that I'm doing like warming up the shoulders, and then I'll transition back so that I'm warming up the low back as well. Okay, where are we transitioning to next after this?
Elizabeth, can you show the upper back part of the butterfly up into the neck too?
Yeah. So if we're going to take the butterfly up into the neck, just take it around the shoulders like that. And I often will add a little jostle to it. And then sometimes I will pause for a quick compression and then continue my stroke.
How far down in the arms do you go typically?
It depends. It just depends on what we have going on, how lotiony I am. If I have an abundance of lotion on my hands, I'll do longer arm movements to start with just to get some of the lotion off. So we'll come up over the shoulder. And we want nice soft hands as we're traveling over these bony landmarks here.
Do you also go up to the neck?
Yes. Although I typically save that a little bit later in the massage, once I've warmed things up a little bit more.
And the other day, Lucy said hands follow hands. Does that also apply here, I'm guessing? Mirror kind of deal?
I'm not sure what.
Oh, okay, it was just something she did? Alright. Everybody, she said,
I didn't see that.
yeah, she said hands follow hands. When we were going to the trapezius area. I wasn't familiar with that little riddle.
Is it just directionally?
Yeah.
I didn't catch the context.
I was going up the side of her back like this.
All right, where are we going next? I think I know, but let's see if I actually do.
Lapping, pulling on low back. Lapping and pulling is a type of muscle for the low back.
How would you, it says, end the last stroke at the low back, leaving the hands on the client, pivot, so you're in a lunge at the side of the table, facing the table, at the low back.
So when we're going to transition there, I will just take a step to the side.
What was that lapping, pulling?
Mm-hmm.
That was a nice transition.
Thank you.
Little golf clap.
And I'll often do this from both sides just because I don't get a good like pull with the heel of my hand like I do on the other side.
So where our wrist palm pressure, if we're to get near the floating rib area, like how do we identify not to, or is it just basically a palm's length is lapping?
So, yes, so you're in this space that's about, well, for my big hands, it's about 3 finger width. So I don't have a whole lot of pressure
Would that pinky
with the
touch
pinky.
floating rib?
I'm also directing more of my pressure like to the top of the iliac crest than I am like into the ribs.
You're like pulling it up.
So I'm like pulling it around, if that makes sense.
Like she probably feels a pull in her belly or something.
No, I think she doesn't want her back because you're just like moving like the spine and stretching
like
it. You can
pulling
get
the skin
a
on your
release.
back and your belly skin is just.
When you do the actual pull instead of the lapping, sometimes you will feel it around the anterior. If somebody has really tight low back,
Yeah.
sometimes you'll feel it.
It looks very transverse abdominis.
Yes, you definitely can get in there. So I will warm up with some lapping, and then I'm going to slide a real soft hand, not under the sheet, that's my barrier there, but I'm going to slide it right into that space at the top of the hip and then pull. And you can get progressively deeper and deeper.
Is it contraindicated to, or not contraindicated actually, but just like, if somebody has some enlarged organs, would you just kind of, just go very lightly
Like
down
inflamed or something?
enlarged?
If somebody had an enlarged organ, like I'm thinking of my husband in particular, he has an enlarged liver and an enlarged spleen.
Same.
Really?
So I probably wouldn't do this maneuver getting in there. One, his abdomen is really sensitive, but I would probably avoid this.
All together, not just do it softly just for continuity or?
I would probably just do the lapping,
Mhm.
but not the pulling.
Okay.
So notice how Elizabeth's fingers are getting really deep in there. And you want to really get right on this border where the muscles attach. Everybody is really tight there. And it's a great place to sink in. Everybody loves that.
Little hand part. All right, I'm gonna, just for thoroughness sake, we're gonna take this over to the other side. Because you can already see that Keisha's back is, like this side is relaxed, it's a little bit longer, and this side is still quite shortened.
Ooh. I was getting a little Blair Witch Project, that transition. We were in the woods there for a while.
Do you need me to cry into the camera?
Good. It's like Elizabeth.
It's so scary.
That looks like a fair amount of pressure.
Yeah, especially with, you have good biomechanics.
Well, the organs don't really push back, do they? Much.
Depending on the person, too, sometimes you can get a better grip and actually like really pull them. But any lifting here, even if you're not lifting, your client like completely and like rolling them a little bit,
Yeah.
you will feel really good. I had a male student here with giant hands who would do this, and it felt incredible.
Oh, it's so good if you like squeeze from both sides and like lift the client. So good.
Like get down at the end of the table.
I just squeeze from the outside and inside in.
All right.
Yeah, big hands are very comforting in a massage.
Hmm.
Big hands are very comforting in a massage.
So as I'm moving laterally, I'm using more of the heel of my hand because I'm noticing that there's a lot of tension here in the QL. So I'm gonna press with the heel of my hand and then lift with my fingers. And I tend to use both hands to lift just because the extra power is really helpful and it just feels more secure and not quite as pokey with my fingers.
I have a question for when you're using the heel of your hand when you're going down.
Yeah.
For someone who's a bigger, like me, you get more skin, so you run the risk of like pinching it, like against
Yes.
your hand on the table. What would you recommend for that? Because you do, as you're explaining, have to go deep.
So I
area, so.
don't, if somebody has loose skin or is just a bigger person, I won't go all the way down to the table because that, it has a tendency to get a little pinchy right there.
And the other thing that, you know, people kind of often wonder at the beginning is that, you know, when there is adipose tissue, which is just the other word for fat, what is most comfortable is that you press right through it. There's always muscles under it. So just press right through to the muscles.
What did you call it?
Adipose tissue?
Adipose tissue. Thank you. I like that so much more nice. It's so much nicer than fat.
Right, there
All
we
right,
go.
I'm already transitioning to other stuff. What's next on the list?
Check massage sides of body. Scoop and squeeze from low back through the lats and lateral border of scapula. Do not just squeeze the skin. Do not touch this.
All right. This product absorbs really quickly. So I'm going to swoop around the side here, but I'm not going to curl my fingers like under her body. And some people, like myself, our breast tissue kind of gets into our like armpit when we're face down. And if that's the case, then I'll just take it like around the lateral border of the scapula, maybe a little bit lower than that.
Would you want to try to get into the groove of the lateral border?
I usually like try to curl under a little bit so that the teres and lats get some attention here. I'm sure that you guys have noticed that I swing my body a lot and shift my weight from foot to foot. All right, I'm gonna transition to the other side. So instead of being focused on don't touch breast tissue, don't touch breast tissue, because that's a good way to freak yourself out and then touch breast tissue, I concentrate just on really loosening up the teres and lats in this spot. And that kind of helps to keep my fingers in the right area and not straying too far. And I can get progressively deeper and deeper. All right, what's next?
Warming friction on upper and mid back. Stand at the head of the table, using your hands and fingers flat. Rub vigorously, repeatedly back and forth on the erector spinae, rhomboids, and middle trapezius in the upper and mid back region until this area becomes visibly more pink and possibly warmer. Start lighter and get progressively deeper. As you get deeper, you can use the ulnar border of your hand.
So, oh, go ahead.
This is similar to effleurage, but there's a faster back and forth motion. You can stick to the side of the table to work on the interspinatus, lats, teres, and deltoid. You can use a twisting motion with your whole forearms. Make sure you warm the tissue well with effleurage, petrissage, and warming friction before sinking deep into adhesions and or trigger points.
I don't tend to use the sides of my hands much for friction. I'm not sure why. It's just not super comfortable for me. Just be careful as you speed up here that you don't accidentally bonk your client in the back of their head. I did that to Zephyr when I was in school. And then I pretended like I didn't, and Zephyr totally called me out on it. And you'll notice that I speed up and then slow down a little bit. I'm still getting some nice deep friction here, and I'm still warming it up. And then I will go back to a little bit faster friction.
It's nice to change the tempo so it's not as repetitive.
Yeah.
Are we being mindful of the fibers as well? Like when you do the friction, or is it just kind of more
For
direction?
warming friction, not really. I mean, not for me at least.
It's the universal standard.
If I were going to be doing like linear friction or cross fiber friction, I'd be more mindful of it.
The last part of the directions talk about the infraspinatus and deltoid, taking it out laterally a little bit.
Mm-hmm. All right, I can feel her back like radiating heat. We've got it so nice and warmed up. What's next on the list?
Zephyr's erector combo stroke. Rocking effleurage and compression. At approximately the level of T2, press on the lateral border of the erectors with your fingers together or your thumbs. Press into the tissue at this level repeatedly in a way that both compresses the tissue and rocks the client's back. Continue with this motion as you continue the stroke down the length of the erectors down the back. pay attention to what areas are especially tight.
Okay. Now, I think I do this differently than Zephyr does. Because you're talking like more like this, right? Get a little wiggle in there.
So this one, you could come from that direction, or you can go from one side and do the other side, coming towards the spinous process. Would that be
Yes.
it?
So I kind of swoop in here at the top of the shoulder, just to make sure that I don't have like this dead zone here, where I'm like starting like here and not really getting into the tops of the shoulders. And then I'll do a little wiggle. Now I usually do this with ironing with loose fists. So when I do this, I get in with a loose fist and kind of use my fingers coming up like this. And then I'll like raise myself on my tippy toes a little bit. And if I find a spot that I feel like needs some extra attention, I can just hang out here and maybe give a little jostle. And then continue down to the iliac crest.
When you're doing that, are you applying pressure with your thumbs at the same time, or are they just loose?
My thumbs are loose. If someone has a long torso, I will start the movement and then transition sideways, keeping my pressure even. I don't want to tilt and have more pressure on one side than the other.
So Elizabeth, would it be the same type of thing though? Like if you came in from the side and kind of did this along the side of the spine? Or do you feel like this is different?
I do that. That's more of a petrissage. And I think we're going to get there.
That's how I do that one.
This is,
Maybe it's because I've seen Zephyr do it that way, but both ways, either way could work, right?
yeah, so usually I will do ironing down the back, and then I'll come in with the heel of my hand.
Should we continue to the back of the occiput where they apparently originate from? Or
I
no?
don't necessarily, like I'm not going to use the heel of my hand per se
Or
as I'm getting in there, but you can take it all the way up to the neck. I do most of my neck work when people are supine, but when they're prone, I want to say hello to the neck and just like reassure them that it's not going to be ignored. And you can do the same move on the other side, on the opposite side. I like to do it more on the same side, but you can also do it opposite.
So they originate from the head and neck and insert into the hips.
Yep, all the way down.
Part of creation.
All right, what's the next step?
Erector ironing. Utilize your forearms to flush down the erectors one side of the spine 2 to 4 times. This is a deep effleurage.
All right, so this is my own personal challenge.